So what are we going to do when we find a soft marker in the ultrasound? As I mentioned, whenever we see unusual in a fetal ultrasound, I think it's worth sending the mother for a proper detailed anatomical survey with a proper fetal echocardiogram for a tertiary scan, and then to make sure that everything else is normal and the parents are counseled well about the finding, and so that they have to understand what is happening in the baby. So it's a good chance that we can talk about all these evolving problems also, which are very much treatable when picked up at the right time. So when it is isolated, single aneuploidy marker, we're just going to stop evaluating at that point in time. And we have to also look at the chromosomal aneuploidy results. And as I mentioned, if it is low risk, then we are reasonably sure that the baby is fine. So moving to aneuploidy screening, chromosomal abnormality screening or Down syndrome screening, it could be of varying types, by which I mean that it could be performed in the first trimester, in second trimester. What we generally stick on to now is the first trimester combined screening, and we reserve the second trimester aneuploidy screening quadruple marker test for women who have missed the first trimester ultrasound combined screening. And when it is positive, again, we need to send the mother for a proper anomaly scan and a fetal echocardiogram, so that they can be counseled from there whether they have to undergo further direct invasive testing or not. And when a woman had a cell-free DNA test or non-invasive prenatal testing for chromosomal aneuploidy, and if it turns out to be a positive result, then definitely this requires further confirmation by amniocentesis. So we have been talking more about chromosomal problems and all the soft markers which we have been discussing, where in the context of chromosomal problems, essentially they have been discovered to identify a chromosomal abnormality in a fetus. But is this enough, or is there anything more? So I think we also have to remember that whenever we come across a chromosomal abnormality, a soft marker in the fetal ultrasound, we need to remember about evolving problems and strongly advise the parents to come for postnatal follow-up. So this is how I would like to classify the findings. Findings which are expected to be not of concern are echogenic intracardiac focus, isolated choroid plexus cyst, and isolated single umbilical artery. Remaining all findings, all the other markers will be considered as findings of concern, though we are not going to press the panic button to the parents and we are going to tell them the outcome is going to be good, but still they all need follow-up to pick up later evolving problems. So soft marker could represent chromosomal abnormality, non-chromosomal abnormality. So when we are reasonably sure about the baby is chromosomally normal, then we need to think of evolving abnormality. Again, I would classify this into structural evolving abnormality or a growth abnormality like fetal growth restriction. And there is always a small subset of genetic disorders which we have to bear in mind. Though it is not common, I would say that we quite often come across all these parents. And whenever we suspect all these, we need to work up these couple. We have to get a proper pedigree, and we need to look at the old records. If they had any bad obstetric history, then we go and look at those records. And when we find a soft marker in fetal ultrasound, there's something beyond the chromosomal problem or Down syndrome. So we need to follow up these babies. It's because there could be some evolving abnormalities like structural fetal problems, abnormalities, or fetal growth abnormality like fetal growth restriction. So I think the answers for many of these questions which we have in our mind as imaging specialists, as pediatricians, neonatologists, all these could be answered only when we have a proper postnatal follow-ups for these babies. So whenever there is anything abnormal in a fetal ultrasound, and if you think that it's Downs, and if you rule out it's Downs, still, please don't stop till then. These findings could be subtle markers for some other evolving problems or points of concern which could be very much be amenable to treatment in the postnatal period. Hence, recommend postnatal ultrasounds for these babies as per the antenatal findings which you come across during the anomaly scan or a growth scan. So I think bridging this gap is very, very important. Fetal imaging specialist or fetal medicine specialist should closely work with the pediatric specialists and neonatologists. And this helps us to understand a lot about the pathophysiology. Thereby, again, it helps us to give a proper counseling for the parents during the prenatal period. So my carry-home messages would be a positive ultrasound marker for aneuploidy will definitely need a proper detailed anomaly scan with fetal echocardiogram. Any unusual minor marker or a soft marker needs follow-up, and postnatal follow-ups helps us to understand the pathophysiology better. Also, of course, it's going to help the babies, whether, for example, if it's going to be a renal pelviectasis, we need to rule out that it's not progressing to vesicoureteric obstruction. And whenever we see an ARSA, then we need to rule out a vascular ring. These findings are not going to present as medical emergencies in the newborn period or in the infancy period most of the times. But still, it's a good opportunity for us to identify these findings in the antenatal period so that this can help the baby a lot as far as the outcomes are going to be concerned. Counseling plays a major role, not just for decision making, but also for making the parents come back for a follow-up